Fixing this one mistake could have saved this frog's life. This red-eyed tree frog presented to my clinic for lethargy and not eating. Its cage mate had passed away a week or two before, but the owners weren't sure if it was related. On my exam, I noticed these ulcerations to the skin. With amphibians as small as these, our diagnostics can sometimes be a little limited. However, on a hunch, I tested the fecal sample for parasites, and lo and behold, we found our answer. These frogs had a parasite called Rhabdias, and it is common among amphibians. This parasite is dangerous because they are self-fertilizing, can survive for some time in the soil, and they have a direct life cycle. This means they do not need an additional host to reproduce, and pass directly from frog to frog, even reinfecting the original host and causing superinfections. Rhabdias is a lungworm that causes damage to various organs by migrating through the body and causing secondary bacterial infections. They can even cause open wounds like you see here. Infected frogs can be asymptomatic at low levels, but this can be life-threatening. Unfortunately, due to the degree of infection, the frog did not make it, even though we dewormed it as soon as we had a diagnosis. Once amphibians start to show signs of debilitation, it's often too late. I felt so bad for these owners because their husbandry was great and they were doing everything for these frogs, yet unfortunately they were sold to them already infected. This is why it's so important to quarantine your reptiles and amphibians and test them all for parasites, even if they're not showing any symptoms.